Welcome to Homeworkology. As a community, we're making homework each and every day.
Welcome to Homeworkology. I'm Sean Gibbons, and I'm joined today by Dr. Tiffany Tucker. Tiffany, thank you for joining our homework community. We're really interested in getting to know you and learning about your experiences and all that you've encountered as we are all trying to navigate this new environment, this new work environment. Could you tell us, first of all, let's just figure out a little bit about where are you from? Where were you born? Where are you from? That kind of thing.
Awesome. Thank you so much, Sean, for having me. I am originally from Maryland, born and raised. I actually moved to the Philadelphia area in, I believe, 2008, 2009 to attend Drexel University College of Medicine. I did a post-bac program first before going to their medical school. And then finished there in 2013 and was accepted into residency at Cooper University Hospital in Camden, New Jersey. So I've been in the South Jersey area since 2013.
Oh, wow. So at this point, you're kind of like, you have a dual citizenship.
Yes.
You can claim either one. So as far as I'm concerned, we embrace you here and we claim you as our daughter. Now, your mom might have something to say about that.
I was getting ready to say, every time I talk to her, she's like, so when are you coming home? When are you coming back? I'm like, Mom, I've made a home away from home here. So she's slowly coming around to that idea.
Yes. So the type of medicine you practice is what?
I am a general pediatrician.
Okay. And before 2020, how long had you been practicing?
Oh boy, so I've been out practicing, so when we finish medical school and we enter residency, you are being trained in whatever field you chose. So I was being trained in pediatrics. So I've been doing pediatrics since 2013, but actually out on my own or as an attending physician since 2016.
Okay, so you had a nice little runway in terms of just kind of understanding what the landscape looked like before the world got shut down. In fact, one might say, my dear, that you were a bit of a pioneer in terms of this kind of virtual medical care. Tell us a little bit about your pediatrician practice for schools.
Sure, absolutely. So in 2019, I was looking to kind of go out on my own a little bit because there were some things I noticed in healthcare that I thought could be a little bit better. And so looking for some ways that I could help treat some of my patients in ways that could help overcome some of the barriers that they were facing, I came across telemedicine. And I wasn't the very first, for sure. There were other places doing it, and particularly Cook Children's Hospital had a telemedicine that was basically dealing with schools. So I started looking into school-based telemedicine. There weren't a lot of people in the space at the time. A lot of, certainly pediatricians weren't doing telemedicine care at all. What we had that was probably close to it was the mommy call, where parents would call in, after hours and ask questions, but it was all over the phone. It wasn't virtual. So I started a school-based telemedicine company in 2019, and I partnered with the Camden City School District. Cooper, as many people may not know, is located in Camden, New Jersey. So I was already taking care of those families, getting to know them well, and I was able to see the challenges and the barriers that they were facing when seeking care for their kids. Things like transportation was an issue, finances, maybe having childcare for other kids. And that was something that either they would prevent them from coming to visits at all, they would show up late to visits, or just have all these additional challenges that we also had to deal with during the visit too. So sometimes made the visit a lot longer. And so when I introduced this concept, I presented it to the schools, the school nurses, and to families, and they absolutely loved it.
So you decided that you would graduate from medical school, and then you would just go ahead and do a practicing doctor, and then become an entrepreneur and go and open this whole thing that really identified and addresses the needs of marginalized folks in communities that are underserved. Is that what you did?
That's kind of what I did. There were some steps in between there. I will say I continued to practice after I finished residency. I stayed on at Cooper for a couple years in primary care. Absolutely loved it. But I said, you know what? There are some things that I want to do that I don't feel I can do within this setting, just because they were, I don't know, sometimes when you deal within the healthcare setting or the healthcare business, which is what it is, it's hard to affect the type of change that you want within sometimes the bureaucratic model that we are stuck in. So while I was at Cooper working, I actually went back and did a physician executive MBA. And so while I was in that MBA program,
why don't we just get it all in?
While I was in that MBA program, that's where I started Peds Purpose. So I was working, I was going to school and starting Peds Purpose all at the same time. And so I left Cooper in about 2018. And I started doing urgent care work. And I was in urgent care. I liked the schedule. It gave me a little bit of flexibility to kind of do my schoolwork and design my schedule around my life at the time. And so then I've been doing kind of urgent care work since, and still doing urgent care work while I continue to build Peds Purpose.
I see. So since Peds Purpose was in place when 2020 hit and everybody got shut down and sent home and the world just got turned upside down, were you able to still be effective? Because if your primary audience was school-based and now nobody's in school, how did that impact your business?
I'm going to tell you, we have faced some hurdles for sure. We have effectively stopped and started just like everybody else multiple times, because it would seem like, you know what, you're in that virtual space, everything should be great and your business should be flourishing. Well, you're right. When our primary population was no longer in schools, or the schools kept shutting down,
yes,
there was a disconnect there. So we would lose those patients, and then they would come back to school. So it was a lot of ups and downs. And then we found out some things that weren't as obvious to us before. The broadband connections at their homes were not in place like we thought. Or a lot of people did not have the internet connectivity that a lot of us assumed that they had. So once they got home, we couldn't even necessarily continue some of those services because they didn't have internet access.
Yes.
So we were only able to capture them in the school environment. Now, some programs and some companies like Comcast and Verizon did step up in a very big way to come in and bring internet access to some of those communities. They would actually have like buses in certain areas with antennas on them so that families could have internet access. But there was a lot of challenges there that made it so that we were not as effective as I would hope that we would have been, because there were barriers that we were still discovering throughout the pandemic.
Well, I will tell you that, we've been doing this now for a minute, and the conversations that are repeatedly had, there's a couple of themes that we're hearing. And one of them is how unaware we were about the disparities in people's socioeconomic situations and what your pandemic experience or post-pandemic experience looks like based on where you were financially when it started. And so for those underserved communities, if you think, that people were sad and anxiety ridden and whatnot, well, for those folks who couldn't get any access, who didn't have the room, the means, or even the information, it was very, very, very trying. And so I'm glad that you were really giving voice to just the things that we take for granted at times, like having internet or having a spare bedroom to put your office in. Really, that is why Homeworks Well, which is what sponsors Homeworkology, even got started, because when we started to look at how people had to work in these remote locations, and we realized that the resources that large organizations and companies that you're used to working for, they bring these resources. All of a sudden, you're home, you have 2 children, you have, however many things that you're juggling. And it's not just a chair, it's not just a product. You need a community to really embrace you, all of us, to help us get through whatever aspect we're dealing with. And so I thank you for bringing that up. So then once that happened and you realize, okay, this isn't going to be viable for us right now, and you're there with the urgent care and you're trying to serve people as best as they can be served. How do you do that when people are all wanting to be remote and everybody is not wanting to come into work and people are trying to dial it in, but not actually be on the front lines? Because you all are frontline workers.
Yes, so you touched on a lot of issues that we definitely had to face. In the beginning days when nobody really wanted to come out, a lot of practices took a hit, including urgent care, including your primary care practices and some of your smaller practices, to the point where they had to close. And there are some that did not recover and did not return, unfortunately. I was working for 2 different urgent care systems during the pandemic, and one of them shut down permanently during that time. We saw a significant dip in the numbers when everyone was afraid to come out initially. So the urgent care that I worked for, the second one, did implement some telemedicine. So we would see patients there, but there were times where if there just weren't enough patients to see, doctors were being furloughed. We couldn't have imagined a time, we always thought, no matter what happens, the apocalypse can take place, doctors are still going to be needed. But there were significant months where some of us were at home, either picking up telemedicine work for other companies, or just waiting for things to change.
Yes.
It did come back and patients came back. It was a trying time because, we were dealing with like PPE, the protective equipment shortages and things like that, but we made do. And then slowly but surely, the volume picked back up, and then parents started feeling comfortable again bringing their children out. So we would go through these surges of, almost like feast or famine. Either we'd have very few patients some days, and then other days we'd have an explosion of patients, especially when the school started opening back up and, all the kids started sharing their germs again. And then, they would come back, and then we got into flu season and RSV and enterovirus. Then when that hit, and we got another surge. So in the meantime, while my business was going through its challenges, there was a need for us to really come back into the urgent cares and the other settings where we were working, the emergency rooms, as those patients started coming back. So I was helping with the surge there. I always have been of the mindset to go where I am needed. And so when the need was there, I kind of, my own personal business kind of took a back seat. Make sure that the population that we were caring for at the time, their needs were met. And because a lot of people have staff shortages right now, whether it's nursing shortages or physician shortages at a lot of different healthcare systems. And so I kind of have tried to fill in the gap where I was needed.
Well, Dr. Tiffany Tucker, I want you to know that I appreciate your candor, because a lot of things happen behind the scenes in our lives that people are sometimes hesitant to share. And what we don't realize is that by sharing them, we just let our neighbor, the person to the left or the right of us, know that, hey, it's okay. Because the best laid plans, like we all thought that investing in real estate was the smartest thing ever. You get a couple of duplexes or triplexes, it'll never go wrong, until the pandemic, and then nobody had to pay their rent for months and months at a time. People said, hey, go to medical school. You will be good for the rest of your life. Just do your time, get through it, and it'll just be like a street paved with gold. Until the pandemic, and we had to all get through it. It's like everything your mother and father said, this is the safe way to do it. Yeah, but then when the world shuts down, is there a safe way?
A once in a lifetime, for a lot of us, a once in a lifetime event that I don't think a lot of people could have fathomed, for sure.
Not at all.
There were surgeons who couldn't practice surgery because all the operating rooms were shut down. I mean, people that you just would not expect to be either without a job or told to, hey, you can practice this type of medicine that you may not have seen since you were a resident.
Right.
In the meantime, but yes, you are absolutely right. The best laid plans. And I think a lot of us learned to just go with the flow because you had no control over anything. So for a group of people who are used to being in control of something, to have control of nothing it's like, okay, take a deep breath, we're going to get through this together. And
Yes,
I appreciated the team dynamics of the groups that I did work with, because we were each other's support system for sure.
I was going to ask you about that. So I was going to ask you about, the group of people that are there to care for everyone. How do you care for yourself? What do you do to fight off, I don't know, depression, isolation, all of the things that, a lot of people turn to alcohol and a bunch of other stuff, like the levels of alcoholism just went right off. So tell me what your group did, or what you saw people doing to just manage it in a more productive way.
Absolutely. Healthcare providers certainly are not immune. We definitely saw some of that within the healthcare community too, of alcoholism and other substance abuse rates that increased during the time, because there were periods of isolation. I think within the groups that I worked for, we kind of checked in on each other. We would have Zoom sessions. I leaned in on my faith more than I have in a very, very long time, because church was very important. I appreciated so much that a lot of the pastors and the spiritual community brought their messages online, because even if you couldn't get to the house, you could turn on your computer and praise, worship, and do whatever you needed to do. So aside from, us just having Zoom sessions with one another, I also leaned a lot on my faith. I don't know what I would have done without that, because there were times when isolation was tough, for sure.
Yeah, absolutely.
And, not being able to touch family or, be in contact with, because I isolated myself a good portion of that first probably year and a half. I did not go home. I didn't, want to be able to hug. Not that I didn't want to, I couldn't hug, grandparents, parents, because I kept telling them I am still treating people that are very sick. And I do not want to even bring the possibility of that into your house. So I definitely stayed away. But we tried as best as we could to support one another, and just, Zoom became a big part of people's lives, to be able to talk to loved ones, colleagues that you may not have been able to see. So we tried our best to keep in contact that way and just check in on one another. Social media isn't my favorite place, but I, reactivated certain social media pages to be able to keep tabs on family and friends. That connection. So for sure, for all the, the negative parts about social media, that was the positive for me, that it really allowed us to stay connected during that time.
Right. And then the truth of the matter is, as a very secure grown woman, social media's impact is lessened. I think the concern is that as you have developing minds and young people who really absorb social media way too much, but also as more of a reality than it really is. Like, they don't understand a filter is truly a filter, and it filters out a lot of stuff that really is really a part of life, and you're not ready to deal with that yet. But I digress, because what I really want to talk about is what dating was like during the pandemic. Just that's called no segue whatsoever. And you can put a stop sign on this.
You know what? I will say that was a bright spot in my life during the pandemic.
Really?
I did not go into the pandemic in a relationship, but I came out with one, and so God is good.
Yeah.
I met someone during that time, and it was not a complete stranger to me. It was someone whose our paths had crossed, but just at a time when I wasn't ready.
Yes.
So we kind of revisited that, and love blossomed.
Yes, that's interesting, because sometimes when we are, going to medical school and graduating from this and then getting to starting businesses, we are so busy that we can't slow down to kind of really nurture other aspects of our lives. And for me personally, I saw that a lot of my relationships really did kind of redevelop during that time, old friendships, and even my primary love relationship, all of those things, also known as my husband, because he's gonna be like, what did you just call me? Yes, but those things we really had a chance to tend to, that sometimes they get neglected, and just the running around and doing the things that we do.
We had a lot of time to reflect on priorities and what really mattered And
Yes.
I think if anything good came out of the pandemic, it was that we
Yes.
slowed down and reevaluated what was important. And sometimes, I'm a go-getter and I'm used to chasing things. And sometimes you just have to slow down and
Be still.
in that moment, be still, be content in
Still.
that moment, and just be grateful for what you have and who you have
Yes.
in your life. And I think slowing down, that definitely helped me see what was in front of me and some things that I didn't see before. So that was good. And I certainly am super happy right now. I have no complaints about my love life.
Well, I am so happy to hear that. I know that the folks that are behind me, who kind of produce this show and support us, would like me to just say that Homeworkology is located in the Chestnut Hill area of Philadelphia. And we are very focused on making sure that we are providing all of the services and products that allow people to work well wherever they are. Now, having said that, I can get back to our conversation with Dr. Tiffany Tucker. The last thing I want to ask you is, now what? Now we're they've said no more pandemic and we're on the other side of it. What are you seeing in terms of healthcare and best practices, and what would you like to see happen?
Sure. So the national emergency has been lifted. We still see occasional COVID cases. So COVID has not disappeared, but the emergency has been lifted. So we still want to see people taking those precautions, hand hygiene, wash your hands, as much as you think about it, wash your hands. So we still want to see that.
Wash your hands anyway, right?
I hope they are, but listen.
Your mama should have got that through to you. I'm just saying.
If you're not feeling well, stay home. Things that we are seeing that are different, and I hope to continue to see. Telemedicine isn't going anywhere, and I'm so glad. So we're going to find ways to incorporate that and have some sort of hybrid, because it was beneficial or is beneficial to a lot of patients, those that may be homebound, chronically ill, or just you need a quick check-in with your doctor. So I don't think that's going anywhere, and I'm happy about that. We want to continue to see the insurance companies continue to pay parity rates for telemedicine, to reimburse providers for the services that they are providing. So we want to continue to see that. As far as for Peds Purpose, what's next? We have pivoted in some ways to allow parents to be able to call in directly and it not have to be just through the school nurse. So that has been very helpful. We've taken the time over these past 6 months or so to get credentialed with more insurance companies, because that at times is a pain point for us and a lot of other providers. It can be a lengthy process, but we want to make sure that the patient, because the patients that we're serving, which a lot of times are underserved and marginalized patients, a lot of them are covered under the Medicaid plan. So we wanted to make sure that that was in place so that they would be covered and there would be no issues with them receiving care. We do not turn away any patient, no matter what, whether you have insurance or you don't. That will not be a barrier to seeing us, but we want to make sure that if they do have insurance, we're able to collect the insurance.
I have one, well, I shouldn't say one more because it always leads to another. That's why they hate me over there. They're sitting there now. Okay. Physicians, assistants, and nurse practitioners. Where would you like to see that lane, as opposed to because I'll tell you who I am. I want to see my doctor, and I want to see my doctor. I know when a nurse will get it done, and I know when I need a doctor, and I don't want to hear anything else. So, as a physician, please just, if you have an opinion.
Sure. Now, it is your right, based on the Patient Bill of Rights, to ask for a doctor. And if they don't have one, they have to tell you that they don't have one, but it is your right to ask for a doctor. There are roles for the mid-level providers, the PAs and the nurse practitioners. And it just depends on, what level of patient care they're providing versus acute care, primary care. I have seen some good in it, and I have seen some not so good in it, having worked with some myself, having been tasked with supervising mid-level providers. I think in collegiate roles where they are being appropriately supervised and appropriately working with physicians, it is fine. I see, however, though, that all too often we are seeing them being put in positions where they are working independently, sometimes in high stress, high acuity, or high volume environments. And I do not think that that is appropriate, depending on how long they've been practicing or what their backgrounds are. For example, the nurse practitioners, they may have been a nurse for numbers of years, 10, 20 years before they decided to do that. They have experience, that's fine. PAs, on the other hand, maybe just coming out with 2 years of book knowledge and, however many hours of, clinical time, which during this pandemic may not have been true clinical time, and they're being given all the same privileges as providers. I do not agree with that. That is a problem when there is not appropriate supervision, and sometimes they are in positions that they are not comfortable in. And so that is something where we need continued oversight to make sure that quality care is still being delivered safely to our patients, because a lot of times we will see this in certain communities, and particularly minority communities, where they may feel like they don't have a choice but to see a mid-level provider. And that is not true. You're always able to ask for a physician. If they don't have one, you can go somewhere else where they may have a doctor. So that is my take on it. And that's actually
we're not here in Homeworkology to stir a pot, but we just did. And I appreciate you answering us and giving us a perspective that honestly most of us would never really have. I mean, how often do you get the physician that says you absolutely have a right to ask for the provider that you desire, and if they don't have it, then that's a whole different conversation, and you have to figure out what to do there. So I am really happy to hear that Peds Purpose is moving forward and that you're getting the support and the insurance certifications that you need, and that you're also pivoting. I know as an entrepreneur, I was thinking about this driving today, that at the point that you aren't willing to pivot and grow and expand and do things a little differently than you have done them in the past, you probably need to do something different. Because entrepreneurship is always about, expanding and changing and kind of moving. And we all work in different ways. And that's why we do this in Homeworkology. That's why we invite you guys on to speak to our community about your different experiences. And hopefully it connects in some way. And I love how transparent and honest you've been. And we thank you very much for your time. We appreciate you very much. Thank you, Dr. Tiffany Tucker.
Thank you so much for having me, and thank you to your audience.
Absolutely.